Hello, good evening, everyone. This is Dr. Farzan Mistry. I'm a consultant obstetrician gynecologist and infertility specialist practicing at South Mumbai. I'm attached to various leading hospitals like Bhatia Hospital, Wokhar Hospital, Masina Hospital in the heart of Mumbai. Today, we'll be talking about IVF or in vitro fertilization. We are going to be discussing the basics, that is the ABC of IVF. 42. A magical number, isn't it? It is a number with which the God created the universe, according to the Kabbalah. There are 42 generations as per the Gospel, 42 letters in the name of God in Jews. In the Hitchhiker's Guide to Galaxy, 42 is considered as answer to ultimate question of life, universe, and everything. 42 years back, 1978, was a remarkable year. The Big Bang was discovered, Sony made its first Walkman, the man first walked on the moon, and also marked the beginning of the birth of the world's first IVF baby. Today, IVF accounts for almost a million of births worldwide. The increasing demand for fertility treatment drives research and development of technologies to optimize IVF regimens and success, which has come a long way from a single digit success rate of 5%, which was way back in 1978, to 50% in the current era. So let us understand what exactly is IVF and how does IVF or in vitro fertilization works. IVF or in vitro fertilization is the fertilization of an ovum, that is the female egg, outside the body with a sperm in a laboratory, which results in the formation of an embryo, which is then transferred inside the uterus of the woman. IVF is most effective form of the assisted reproductive technology. The procedure either can be carried out using your own eggs and own sperms, or it may involve using of donor eggs, donor sperms, or using donor embryos, which may be from an anonymous donor. So, who are the actual candidates which may require IVF? For that, first we need to first understand the process of reproduction. In the process of reproduction, there is the uterus, there are the two tubes, and there are the two ovaries. In one ovary, a follicle grows, which eventually matures, ruptures out to release an egg which sits inside the tube. Once the relations are kept, the sperms traverse through the uterus, go meet the egg, an embryo is formed, which comes back in the uterus, sits, and that's where the pregnancy continues. So, for a normal pregnancy to happen, you need normal ovaries, normal tubes, normal uterus, normal sperms, and normal hormones in the body. Any issues in any of these areas may result in infertility. The candidates generally requiring IVF are number one, the tubal causes or the fallopian tube problems. These are generally associated with the blockages of the fallopian tube. These blockages may be either due to infections, adhesions, or endometriosis. The next disorder may be in the ovaries. The ovaries, the disorder may be related to ovulation disorders like PCOS, where there is no ovulation, or diminished ovarian function or low ovarian reserve, which is age-related infertility. Endometriosis condition by itself also is one of the reasons why IVF is required. Impaired sperm production, that is either decreased quantity of sperms, decreased motility of sperms, or increased abnormal morphology of sperms are also the candidates which may require IVF. Multiple failed attempts of IUIs or intrauterine inseminations are the other indication for IVF. The other ones are unexplained infertility and any genetic disorder where the embryo has to be biopsied. So, what are the basic pre-evaluations which are required for an IVF? Number one is ovarian reserve testing. Ovarian reserve testing is to determine the quantity and quality of eggs. We first test the hormones which are FSH, called as the follicle stimulating hormone, during the first few days of the cycle, anti-Mullerian hormone AMH, and perform either an ultrasound on a day 2 or day 3 to check the antral follicle counts. To know more about ovarian reserve testing, you can watch my previous videos on 30s is the new 20s. This can help predict how your ovaries will respond to fertility medications. The second test which is required is semen analysis to check for sperm counts, motility, and morphology. The third are the routine blood tests for hormones and infection screenings. That is, you'll be evaluated for thyroids, prolactins, sugars, rubella antibodies, and you and your partner will be screened for infections like HIV, hepatitis B, hepatitis C, syphilis, and recently, in the midst of COVID pandemic, a COVID RT-PCR may be done. Ultrasound examination. This is to check for ovarian reserve and also to check the lining of the uterus, which is the endometrial lining. It also helps us to know the architecture of the uterus, whether there is any presence of fibroids, polyps, adenomyosis, which may further hamper implantation of the embryo. Now let's go on to the process of IVF. The process of IVF is divided into 6 parts. First is pituitary and ovarian suppression. Second is ovarian stimulation. Third is egg retrieval. Fourth is fertilization. Fifth is embryo transfer. And sixth is pregnancy and aftercare. Going on to the first step of IVF, that is pituitary and ovarian suppression. The cycle before your IVF treatment is scheduled, you may be put on these birth control pills. Using birth control pills before the treatment has been shown to potentially improve the odds of success in some patients. However, not all. Also, using of the birth control pills may decrease the risk of complications like ovarian hyperstimulation syndrome, ovarian cyst formation, which is generally encountered during IVF treatment. It also gives rise to uniform growth of follicles. Besides the birth control pills nowadays, estrogens and GnRH antagonists are also used for ovarian suppression. The second process, which is the ovarian stimulation. The stimulation phase generally begins on the day 2 or day 3 of the cycle. In a natural cycle, like we discussed before, your ovary would normally produce only one egg. With IVF, we generally give medications like certain hormonal injections for around 10 to 12 days to encourage the follicles in your ovary to produce more eggs. The most common hormone containing injections are FSH injections, which is the follicle stimulating hormone, and the LH, which is the luteinizing hormone. Throughout your cycle, we keep a close eye on your ovaries and how these follicles are developing. This is done either with the help of ultrasound and follicular monitoring and blood tests like serum estradiol or E2 levels. And thus, we adjust the medication dose likewise. The medications which we generally give are number 1, which is the HMG. This medication contains both FSH and LH, and this has to be administered by a local doctor or nurse. The second variant of the injections which we have are generally the pure FSH injections, which we call it as a follicle stimulating hormone injections. They may be either a recombinant variety or a urinary variety. They are generally available like this in pen forms and can be self-administered either on the thighs or on the tummy. The injection selection depends from patient to patient, and they go on from second or third day of the periods till the time the follicles are mature. Once a follicle reaches good enough, a 14 millimeter in size, we start on certain medications, which is the antagonist, to prevent premature ovulation or rupture of the follicles. These injections are called as GnRH antagonist, or cetrorelix is the commonest formula which we generally use in our clinical practices. When the follicle is ready for egg retrieval or the pickup, generally that happens after 10 to 12 days of injections, or ideally when the follicle reaches 18 to 20 millimeters in size, we give an injection so that follicle may produce a mature egg. Once the follicle reaches this size, you will be given an HCG, which is the human chorionic gonadotropin injections, or any other injection which will help you mature your egg. This injection, called as a trigger injection, is a crucial step in the process of IVF. It readies the eggs for ovulation, and the timing of trigger is critical as the eggs have to be removed out before the rupture of the follicles. Going on to the third step of IVF, that is egg retrieval or the ovum pickup. Now, egg retrieval is around a 20 to 30-minute surgical procedure. No cuts, no stitches. The word surgery might seem a bit scary, but egg retrieval process is quick and essentially painless. In this process, we generally use an ultrasound to identify the ovaries, which now has a lot of cluster of follicles. So imagine this is the uterus and these are the two ovaries close by. These ovaries will be having a lot of follicles which have been corroborated because of the stimulation process in there. We take an ultrasound probe, and with the ultrasound probe, there is this needle which goes in through this. Don't be scared by the size of this needle, as it is big because it has to travel the distance right from the vagina to the ovaries. But the pain is equivalent to just a pinprick. However, you will be under anesthesia during this full procedure. One by one, the eggs are generally sucked out. They will be collected in this tube which will have your label on it, which will have your name and identification labeled on this tube. So eventually all the eggs are sucked out and the follicular fluid will be collected in this tube. These tubes will then be handed over to the embryologists in the laboratory, which will be emptied out in the Petri dishes. Now what you can see is basically these tubes which may be containing these eggs. Once the eggs are collected, they will be scanned and seen under microscope, and these eggs will be pipetted out one by one and taken into the culture media. Once the eggs are in this culture media, they will be put inside the incubator for around 3 to 4 hours before the next procedure. The next procedure is the fertilization. Fertilization procedure first is sperm collection. If you are a couple planning to using your fresh sperms, the male will produce a sample in the morning of the egg retrieval. If you're using a frozen or the donor sperms, our embryologist will already be having the sperms which will be ready in the lab. Now, fertilization can be attempted by two common methods. One is a conventional insemination, or what we call it as IVF. Once the sperms are deposited, they are prepared in this test tube, and generally all the sperms are sucked out and inseminated with these eggs. As you can see, these eggs and the sperms are placed inside the eggs, which will be later on kept in the incubator. This is what the conventional IVF is all about. The other part of IVF is what we call it as intracytoplasmic sperm injection, which is a little bit different from the conventional IVF, and which is a technique which we are generally using these days. In ICSI, or the intracytoplasmic sperm injection, there is only a single healthy sperm which is injected directly inside the mature egg. ICSI is a treatment which is generally used when the semen quality, that is the number and the motility of the sperms, are low, or probably there have been other failed IVF attempts. Once the IVF or the ICSI is done, the embryos are kept in the incubator to grow, and they are further checked for fertilization. This is what generally on the day of pickup, that is the day of the egg retrieval, is marked as day 0. This is day 1, where the fertilization is checked. Your embryo looks like this on day 1. This is what the embryo will look like on day 2, which is generally a 4 cell, as you can see the 4 numbers over here. Day 3 is the embryo which is at the 8 cellular stage. Day 4 is the compaction, and day 5 is this embryo, what we call it as blastocyst. So after the check of fertilization, either the embryos are transferred on day 3, that is at the 8 cellular, or day 5, that is at the blastocyst stage. If these embryos are not transferred, they may also have freezing, or what we call it as embryo freezing, and they may be either frozen at day 3 or day 5 stage. The next procedure is the embryo transfer procedure. The embryo transfer is the final stage in IVF process, where the fertilized egg, which is now the embryo, is placed inside the woman's uterus. The embryo is loaded in a catheter, which is an embryo transfer catheter. Now, this is what generally an embryo transfer catheter looks like. As you can see, the diameter or the caliber of this cannula is very thin. It's generally a hair-like catheter which goes and sits inside the uterus. The embryo is loaded inside the catheter, which passes through the vagina, cervix, and uterus, where it is deposited. The embryo transfer takes place in sterile conditions under a designated transfer room at a fertility clinic. Anesthesia is generally not necessary for this procedure. You should be taking the medicines which you have been prescribed exactly as instructed by a fertility consultant. You will be asked to refrain from taking any vaginal insertions or suppositories in the morning of the transfer. Prior to the transfer, the doctor and the embryologist will confirm your name, make sure that it identifies you and the information of the embryos. Then, with the assistance of the embryologist, the embryo is loaded in this embryo transfer catheter. Around the same time, a speculum is put inside the vagina to visualize the cervix. Now, this is how the embryo transfer process takes place. This is the inside of the uterus. This is the outer catheter, and this is the inner catheter. The outer catheter sits at the tip of at the junction of the cervix and the uterus, and then a thin hair-like catheter which passes inside the uterus, and the embryos are injected right at the place. The catheter is placed inside the uterus, and the injection of the embryo is done generally with the help of the ultrasound guidance. Once this embryo sits in place, We are really hopeful that it implants. After this procedure, the patient is allowed to rest for around 15 minutes afterwards. Follow-up instructions are given. Pregnancy test is done 14 days after transfer. The sixth step, which is the pregnancy test and aftercare. Approximately 2 weeks after embryo transfer, you will have your blood test to measure the levels of HCG hormones in your body. These HCG in your bloodstream indicates a positive pregnancy test. We understand that the lead up to this final blood test, that is the 14 days, can be a very anxious time. This is a good idea to distract yourself as much as possible. Implantation generally occurs 72 hours after the embryo transfer. Patients can resume their normal routines but are restricted from strenuous activities and sex. We recommend going home, relaxing, getting a good night's sleep. Maintain a positive outlook. Find a way to relax and connect with your partner during this dreaded 2 week wait between the transfer and the pregnancy test. Try not to get caught up with those do's and don'ts. But there are certain things which a woman should take in mind after the transfer. Continue all the medicines which are instructed by your fertility consultant. Behave as if you're pregnant. That is, eat and act just like you're pregnant. Stay active. You can pretty much resume your normal routine, just avoid any strenuous exercises. You should avoid or abstain from having sex. Avoid excessive temperatures. That means no hot bath, hot yoga, sauna, heating pad, or electric blankets should not generally be used. The possibility of success with IVF treatment depends upon the age of woman, the cause of infertility, the quality of the eggs retrieved, the quality of the semen, and finally, importantly, the quality of the embryo is taken into consideration when we are judging the success rate of IVF treatment. From 1978 to 2020, IVF has come a long way, from a success rate of single digit to 50% in the current time. Yet, we haven't reached the 100% benchmark. Difficult roads generally lead to beautiful destinations, and I'm sure when you see the smile on the face of your child, you will realize that every bit is worth it. So now we'll be briefly taking the questions one by one. Okay. So first question is asked by Divya Patil. How can I prepare my body for pregnancy? Number one, if you're planning your pregnancy, it is very essential that you start off with folic acid supplementation. Secondly, if you're planning your pregnancy, make sure you eat healthy, stay fit. Thirdly, if you're having any high risk factors, like if you're having diabetes or blood pressure, make sure get all the medications in place and consult your gynecologist before planning your pregnancy, because there might be certain medications which might not be indicated in pregnancy or which might rather be contraindicated. So it is essential to switch over from these tablets or these medicines to a safer version. So generally, ideally for preparing your pregnancy, number one, you have to stay healthy, eat healthy, start your folic acid supplementation, make sure that your medicines are in check, that is all your blood pressure, diabetes or thyroid medicines. Make sure that any other issues like thyroids are under control. If you have any dental issue, make sure that you get corrected before it, because in the first 3 months of pregnancy, there might not be any dental treatment which can be done. So make sure you have a visit to your dentist before you're planning your pregnancy. And secondly, make sure that all your vaccines are under check. That is, just check for your rubella antibody screening if you have a rubella positive IgG or not. If not, then you should be getting yourself vaccinated for such ailments, and then wait and then try conceiving then start preparing for pregnancy. The next question is again asked by Divya Patil. What are do's and don'ts of IVF pregnancy? Like we said, that IVF pregnancy is just like a natural pregnancy. But generally, the first 3 months of IVF pregnancy, what we give generally is the luteal phase support. That is, we give the support to the pregnancy with the help of certain injections and medications. So these luteal phase supports are very important, and it is necessary that you take all these medicines and do not skip them. So it's very importantly, the first thing is comply with all the medications as instructed by a fertility consultant. Secondly, behave as if you're pregnant. So that means just like a normal pregnancy, how you eat healthy, how you stay active, you should do that with your normal IVF pregnancy. Sex is not allowed during IVF pregnancy. You should be avoiding extreme temperatures. As far as certain foodstuff are concerned, there are certain myths as far as papaya, pineapples are concerned, but there are again conflict of ideas over it. So it's always generally advisable to have home cooked good food. So these are generally the basic do's and don'ts of IVF pregnancy. After 3 months of your IVF pregnancy, your pregnancy invariably follows a natural course like that of a normal pregnancy. So that is the third month, you get your NT scan done, you get your tetanus immunizations done, you check for your quadruple markers, you check for your anomaly scans like that you do with your normal pregnancy. The next is how can I make my IVF successful, which is asked again by Divya Patil. IVF has a success rate of 50%. So cumulatively, there is nothing what you can do which can increase your success rate of more than 50 to 60%. But like what I told you, the first treatments, like the first steps, what you would do with an IVF pregnancy is the similar thing what you can do during your after your IVF to make your IVF successful. Lakshmi Mishra asks why are IVF success rates so low? IVF has come a long way, like I said, from 1978 to 2020, from a single digit success rate to almost 50 to 60%. That is a good enough of a success rate for IVF. When you're trying your natural conception, your success rates go around to almost 5 to 6%. When you're doing IUI, which is your intrauterine insemination, the success rate is only 18 to 20%. So as you compare with these two treatments, IVF has quite a higher success rate of 50 to 60%. Now, the IVF success rates are so low because there are certain aspects of the embryos which cannot be taken into consideration. There are genetics which come into play. There are body's immunological factors which come into play. I generally tell my patients that having a baby is like growing a tree. You need a healthy soil and healthy seed. The healthy seed is your embryo and the soil is your uterus. So the key is putting the healthy seed, that is the healthy embryo, in the healthy soil, that is the healthy endometrium. But what we can only judge is the morphological criteria of the egg or morphological criteria of the sperm. We cannot generally detect the genetics unless and until what we do is PGS or PGT, wherein we take the biopsy of the embryo and check whether the generally say tell our patients that not necessarily a normal looking man may be a good looking man may have a good personality. So similarly, a good looking embryo or good looking egg or good looking sperm may not be genetically or may not be a genetically normal sperm or an egg. So that is one of the factor which generally brings down the IVF success rates because we don't know the genetics behind it. Secondly, implantation is a very complex process. The implantation is the process wherein the embryo gets attached to the uterus. Now, this process involves a lot of molecular genetics into this, biochemical mechanisms into it, and also certain immunological factors. We can not have control over all these metabolic and biochemical and immunological factors. So that is why the success rate of IVF has still not reached 100%. But with the advent of recent sciences like PGT, wherein we biopsy the embryo, there are other certain methods wherein we generally take the culture media. That is, if there is this embryo, we just analyze. We don't need to take and biopsy this embryo. We just take this culture media into our pipette and we send it. We analyze it for the genetic studies, and just this culture media tells us what is the genetics of the embryo. So it is very important. Science is progressing nowadays, which can generally increase the success rates of IVF. It can decrease the time taken to pregnancy. So that is about it. Lakshmi Mishra again asks, how many rounds of IVF is normal? There is no specific number to how many rounds of IVF could be normal. IVF can be done multiple times. There have been a lot of patients coming who are even 5, 6, 7 IVF failures who have conceived at the 8th or the 9th time. So as long as your ovaries are responding well to the medications, as long as the ovarian reserve is normal, as long as we get the eggs, good quality eggs out of you, as long as this good quality sperms produced by the male partner, that many rounds of IVF can be taken. So there is generally no number as per the rounds of IVF are concerned. What factors are not suitable for IVF? Now, IVF is generally done for the conditions like I pointed out, whether there is a tubal obstruction, tubal blockages, and other processes. Now, IVF, like I said, can be done either by using your own egg and using your own sperm, or either it can be used by using a donor egg or a donor sperm. So this is your own egg and this is your own sperm. You can generally use this. So if the egg quality is generally bad, such as in the cases of endometriosis, wherein the egg quality is affected, certain age-related conditions, wherein the egg quality drastically decreases, and patients who have a low ovarian reserve, wherein the egg quality is drastically diminished, there is a chance that you might have to use a donor egg in such cases. Okay. Secondly, when the sperm is a factor, where there is a male factor, where there is low sperm counts, low sperm motility, there are methods like PISA, wherein we can actually put in the needle inside the testes, aspirate out the sperms from the testes, and then do an IVF with those sperms, or what we call it as ICSI, what we generally pointed out before. Okay, but there are certain conditions where testes, also like ovaries, might have gone into failure, which we call it as testicular failures, wherein we again have to borrow donor sperms. Now, there might be a factor where there might be a problem with both, that is a female egg and a female, that is your own egg and your own sperm. So that is the time when we have to generally think of using a donor embryo, wherein we borrow the embryo from outside. This is again coming under scanner. So we have to generally select a specific donor for you, a female donor and a male donor, and then inject the female donor's eggs into a into a donor sperms into a female donor, and then form the donor embryo, and later on go in for an implantation. Now, there are certain causes, there are certain factors in which there is a problem over here, which is happening in the uterus, which is the main factor, which may result into multiple failure of the IVF. The inside of the uterus, that is the lining of the uterus, should be well enough for this embryo to go and implant inside. So if this lining is not proper, if this lining is, if there is a problem with the endometrium, there are certain conditions like endometriosis, which also affect the architecture of the which also affect the internal milieu of the uterus. There are certain issues, there are certain infections like tuberculosis, which affect the endometrium or the lining of the uterus. Over there, the embryo is generally not being able to implant. Over in those cases, you may undergo surrogacy, which is another form of in vitro fertilization, wherein we use a gestational carrier or a surrogate mother. But again, surrogacy is again under a lot of gray zones as per now. How do I prepare my body for IVF? Like I said, eat healthy, lead a healthy lifestyle. There is no way out where you can increase the eggs of the body, but there are a lot of antioxidants which are there. So a lot of foods with the antioxidants can be taken into your diet, can be incorporated into diet. You might go to your gynec, they might prescribe you certain antioxidants, which may generally prevent the damage of mitochondria. Like what we said, there is no medicine or there are no injections to increase the number of eggs produced in your body. A female is born with a certain amount of eggs, and eventually they're going to deplete out. So there is no medicines which can increase these eggs in your body, and that is why after the eggs are depleted, a menopause sets in. So there is no medicine to increase the number of eggs, but there are certain medications, like there are minor androgen derivatives like DHEAs. There are certain antioxidants which can prevent the DNA damage or mitochondrial damage to your eggs, and which can increase the quality of your eggs, which are again a little bit query about it. And again, certain antioxidants which can be also used by the male partners to improve their sperm quality and quantity, which can be taken into consideration. So these are generally healthy lifestyle, healthy diet, avoid smoking, avoid alcohol, and keep your hormones in check, and make sure that you visit your gynecologist or your IVF or infertility specialist, and make sure that you visit them in time and get your treatment timely. Now, the next question is asked by Bhavna Natkar, like how long does this IVF procedure take? IVF procedure, if you're going in for a fresh transfer, like I said, starts from the second or the third day of your periods. There are scans which go on for around, there are scans of follicular study which we do amidst this 10 to 12 days. You are generally put on these injections, wherein we give you this HMG injections or FSH injections, basically for 10 to 12 days. And after your 10 to 12 days of maturity, you're given the trigger and the pickup is done. So ideally, for the pickup to happen, it generally happens during the time of your ovulation. So around 14 to 15 days you can take as far as the pickup is done. Now, there are two ways out. If you're going in for a fresh transfer, your embryo will be transferred either on the day 3, catching day 0 would be the time of your pickup, and 3 days later, that is the day 3, will be your transfer, or that is this acellular embryo can be implanted, or the embryos can be implanted on day 5, that is day 6 after counting from the day of your pickup. So if you catch in toto, around 24 to 25 days is what you're expecting for your IVF cycle to last. But if you're undergoing freezing due to certain conditions, like certain patients like PCO, there might be a chance that we might have to freeze the eggs because of freeze the embryos to prevent any incidences of ovarian hyperstimulation syndrome, which is a complication of IVF. Or probably if there is any problem in the uterus, like suppose if there is a polyp or there is a fibroid which is then in the lining of the uterus, you might have to just take out the eggs and freeze them, then tackle the uterus, and then probably do the embryo transfer later on. So generally, if you're going on for a frozen cycle, so your first cycle of 14 to 15 days will be a pickup. You'll be given a break of one cycle, and in the next cycle, around 14 to 15 days will take for a transfer. After transfer, 2 weeks are generally taken, which is a buffer period, and that is when after 2 weeks after your transfer will be a pregnancy test. That will be the earliest time you'll know whether you got pregnant or not. So ideally in IVF, takes around, if you're talking about a fresh cycle, will take around 20 days. If you're talking about a frozen cycle, it takes around 2 cycles. Now, is IVF a painful procedure? Now, like I said, the process of IVF involves ovarian suppression, which you generally only have to take tablets. The second is the ovarian stimulation, which generally people regard as painful because, like I said, that patients have to take injections for around 10 to 12 days. But fortunately, we are with this advent of this new recombinant FSH injections, they are just like a normal insulin needles. They're very thin needles. They are the needles which generally the diabetics use to inject themselves. So you can inject them very well on your tummy, on your thigh, and they are relatively painless injections. The day of pickup, that is your oocyte retrieval, the entire process is done under anesthesia. Now, though, like I said, this needle may look scary, but it's just like a plain, simple injection needle. This is the amount of pinprick which your ovaries will be having for aspirating the follicles and collecting the eggs. And this process is done under anesthesia. It's just a daycare procedure. So there is not much. It's apparently a very painless procedure. And like I spoke about embryo transfer, it doesn't even need an anesthesia. Such a fine needle, such a fine catheter, which is just like a hair-like catheter, which goes inside the uterus and the embryos are placed. And so you don't even require anesthesia for this procedure. Madhvi Cholera asks, are IVF babies normal? Yes, IVF babies are normal, though there have been incidences that there is only a 1% increase of genetic malformations which are seen in IVF pregnancies. But that 1% mark is again in the conflict right now. And what we have seen nowadays that IVF babies are relatively normal. They're not having much genetic abnormalities as compared to their non-IVF babies. Again, with the advent of PGT and PGT-A or PGT-S screening, what we can do is we can either biopsy this embryo, even check for the genetics, and implant a healthy genetically normal embryo that again decreases the chances of having abnormal babies. Now, like I said, with the advent of NICS or non-invasive culture screening, instead of taking out the embryo, we just aspirate out the culture media and send this culture media just for genetic analysis, which tells us whether the embryo is normal or not, and implant the euploid, which is a genetically normal embryo, which can increase the chances of pregnancy, decrease your time to pregnancy. And after all, once you're pregnant, we again carry on the routine evaluations as we do it for general pregnancy, like a first trimester, that is a 3rd month scan for NT, what we call it as NT scan and dual markers, check for your quadruple markers, check for your anomaly scans. So IVF babies that ways are again genetically normal. Kavita Sahani asks, can you ask twins with IVF? Now, generally, what happens in IVF is if we are like I said, that there are 2 ways of transferring these embryos. Either they can be transferred on day 3 or they can be transferred on day 5. And the day 5 embryo, which is a blastocyst, is a stronger embryo. So we generally go in for one single blastocyst transfer whenever we are going in for IVF cycles. But if you're asking for twins, there are chances that we may put in 2 blastocysts. Twins, again, knowing is a complication of IVF. For all, if you don't know, multiple gestations or multiple pregnancies are rather complications of IVF. We do not want twin pregnancies in IVF. We do not want multiple gestations in IVF. The reason being that multiple gestations or multiple pregnancies or twin pregnancies come under high-risk pregnancies, because with twins, there are higher chances that you might end up with labor pains early. There might be IUGR, that is a growth restriction of the babies. There might be a higher chances that you may deliver earlier than your expected date of delivery. There is a higher chance that the babies may require NICU or neonatal ICU supports when they deliver early. So twins is generally what we generally don't ask for in IVF, and what we go in for a single blastocyst transfer. How successful is IVF? Like I pointed out, Sonam Patel asks, how successful is IVF? Again, like I quoted earlier, that right from a single digit of 5% success rate, we have come a long way to 50 to 60%. So around 50 to 60% is what a success rate of IVF is generally what we look at. But again, like we said, that success rate of IVF depends on a lot of factors, depends upon the age of the woman, the cause of infertility, that is if you have an associated condition like endometriosis, the success rates may go down. It also depends upon the quality of eggs which are retrieved, the quality of the sperms which are obtained, and the quality of the embryo which is there. It also depends upon the lining of the uterus or the endometrium and the receptivity of the endometrium. So this is because of all these complex scenarios, IVF success is not 100%. The maximum what we can give you is 50 to 60%, and that is what the success of IVF is. Now, Revathi Rajamani asks, why do people do IVF? So, like I pointed out earlier in my indications of IVF, I said that if there is any problem either with the ovaries, that is, there is a failure of ovulation, as in the case of PCOS, there is an endometriosis like chocolate cyst, that is the time we can do IVF. Whether there are tubal blocks, either due to any infections, endometriosis, or suppose if someone has had children before and the tubes have been clipped, or there has been tubal sterilization which was done, and eventually if they marry for the second time, or probably if there is an early departure of the previous child, and that is when they really want to open their tubes out, and if the tube opening is not successful, they are the candidates for IVF. Then, like I said, that there is any problem with the sperm factor, which is there is a decreased count, motility, and morphology of the sperms. These are the patients which are generally the patients which are suitable for IVF. So I hope I have answered all your questions which have been given over here, and you can follow me on Baby Chakra and inform just to inform you that my referral code is PARZAN. Online consultation is available. So if you want to follow me, you can follow me on Baby Chakra, and my code is PARZAN. So do follow me on Baby Chakra. Thank you.